And talking about losing face, Chinese vaccines are quickly becoming the source of national embarrassment for Beijing. Their effectiveness is being questioned. Thailand, Bahrain, the UAE, they've all already decided to offer boosters to their citizens who got a Chinese shot. This week, Beijing got more bad news from Indonesia. The scientist who led the trials for the Sinovac vaccine in Indonesia has died, reportedly after contracting the Wuhan virus. Our next report tells you more.
Indonesia was among the few countries in the world which kicked off their vaccination program at the beginning of this year. But now Indonesia is losing its frontline warriors. This is despite access to vaccines, Chinese vaccines to be precise. The latest victim is Novilia Syafri Bachtiar. Reports say she died of a suspected Wuhan virus infection. She was the scientist leading the trials of Sinovac in Indonesia. Sinovac is a made-in-China Wuhan virus vaccine. It's not yet clear if Bachtiar took the Sinovac shot herself, but reports say hundreds of healthcare workers have died in Indonesia, even after taking the Chinese shot. Going by one claim, more than 130 healthcare workers have died in Indonesia since June. Most of them took the Sinovac shot. This trend was bad enough. Now Bachtiar's death has led to more doubts over the efficacy of Chinese vaccines. Health experts are asking if medics should get other jabs to stay protected. Other countries in the region, too, are considering the idea. Recently in Thailand, a document from the country's health ministry leaked. It said that health workers who have got the Sinovac vaccine are worried. They want a booster shot of the Pfizer vaccine. The memo went on to say that such a move would mean admitting that the Sinovac vaccine is not effective. Even in Thailand, doctors are falling sick after taking the Chinese shot. Earlier this week, a hospital admitted 5 members of its medical staff. They tested positive for the Wuhan virus. 2 of them are critical.
Yes, here at this hospital. This means the Sinovac vaccine can't protect people from the virus and the symptoms will be severe compared to those who got the AstraZeneca vaccine, which barely has resulted in anyone being admitted to the hospital. It shows that people who are infected with the Delta variant after receiving the Sinovac vaccine, the symptoms are severe and at the same severity level as people who haven't received any vaccine at all.
The Sinovac vaccine has been approved by the World Health Organization. Its efficacy is 51%, barely enough for an approval from the World Health Body. Experts believe newer variants of the virus can escape the limited protection of Sinovac. The spike in new infections and deaths in Southeast Asian countries confirm these suspicions. With both Indonesia and Thailand now considering booster shots for their citizens, Chinese vaccines are proving to be as useless as their test kits. Bureau Report, WION, World is One.
WION is now available in your country. Download the app now and get all the news on the move.